Good morning. Today is Thursday, March 18th, and this is our weekly COVID-19 briefing update. As of today in Bossier Parish, we've had 13,212 positive cases. That's an increase of 38 since our report last week. Unfortunately, we have 6 more deaths, which brings our total at this point to 286. And the state, unfortunately, is now at 10,056 deaths. However, we do have some good news. The governor has announced that we will remain in phase 3 of the recovery through March 31st, and the mask mandates remain in place, but we can expect the governor to update this on or about the 30th of March. The good news from his media conference yesterday is he announced that effective Monday, March 29th, vaccine eligibility is expanded to all adults aged 16 and older, with one caveat, and that is that youngsters aged 16 to 17 are only eligible for the Pfizer vaccine, but that is tremendous news. In other good news, the Center for Disease Control updated its K through 12 school guidance to allow, with universal masking, students should remain in a social distancing, reducing it to at least 3 feet in classroom settings. And this possibly should facilitate return to more normal classroom seatings for our youngsters. In additional good news, the state received information that our positive cases as of March the 17th is at 2.08, which is a tremendous improvement, which for about 3 weeks now has kept us at the or below the goal of 5%. The problem is that as we race to vaccinate as many people as possible, in addition to all the other good news, the Veterans Administration has now authorized that all veterans and caregivers can get the shots. Moderna recently initiated a study that its COVID-19 vaccine is being tested in children aged 6 months to 11 years in the United States and Canada. And this, as I say, is just a study in an effort to widen the mass vaccination campaign beyond adults. As we all now know, the Johnson & Johnson vaccine has become a major positive factor in addressing the pandemic. As we know, it only takes the one shot, and it doesn't require the special refrigeration for shipment and storage as does Pfizer. We also that it's highly effective in preventing moderate to severe COVID-19 cases. In other good news, the gap between supply and demand for vaccine is narrowing and encouraging. We now have the 3 approved vaccines, and a 4th, AstraZeneca, is under development, but this one is somewhat controversial at this point and not yet approved in the United States. The AstraZeneca vaccine is been tested, and they believe it is ready to be used, but it has not been approved yet. But supposedly it will prevent 79% of systemic diseases, and they hope to achieve the FDA approval by mid-April of this year. The impact of the variants that are surfacing is still not clearly known, but it's becoming a more serious problem every day. Some experts have said that the existing vaccines are effective against these variants, but that more research is required. The CDC has indicated that the variants from the United Kingdom and South Africa are more contagious than the original virus. They transmit at a higher rate, resulting in more people being hospitalized and unfortunately more deaths. It is speculated that the United Kingdom variant may soon become the predominant strain of the virus we're dealing with. President Biden recently stated that the United States will have enough vaccines for every adult by the end of May. That does not mean that the vaccinations will be made at that point, but he has set the goal of having the vaccines available for all of us at that point, and he has a program to also try to ensure that all teachers have the opportunity to be vaccinated by May or in May. He also indicated that the United States may have enough supply of vaccine to start sending some to other nations, which of course is a good thing. Also, just a reminder, the federal government has confirmed that vaccines are available to those in need at no cost to the individual while we are in this pandemic. As we've stated previously, this takes approximately 75 to 85% of the populace being vaccinated to achieve herd immunity. And that there does remain a significant number of people who are reluctant to take the vaccination for a variety of reasons. But if the vaccines are not taken by large numbers, it minimizes the effectiveness of the vaccination and, of course, prevents our returning, or at least achieving, the new normal. It's still estimated that the numbers of people who are asymptomatic is about 50%. They have the COVID virus within them, but they do not show the symptoms, but can infect others, family members and friends, and unfortunately, possibly more deaths. There's been some change in the guidance for wearing a mask. The governor does say that even though we're making improvements, the mandate remains in place that every individual in Louisiana, age 8 or older, shall wear a face covering the nose and mouth when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors, and this includes public or commercial modes of transportation. And the Center for Disease Control also recommends children aged 2 to 7 wear a mask. The CDC also has released improved guidelines for visitations and contacting people who completed the vaccinations. If you have received the vaccination and 14 days or more have passed, you can visit with immediate family members without wearing the mask and adhering to social distancing. But they still recommend it. Try to keep a social distance of at least 3 feet. But grandparents can hug their grandchildren and those sorts of good things with this change. And with regard to the time to be quarantined, it has now been shortened to 7 days, and on day 8, if the individual takes the COVID-19 test and receives a negative result. And it is hoped that by shortening these periods, it will encourage more people to receive the vaccination. The prevention and mitigation protocols, ladies and gentlemen, remain unchanged, but the ones that are stressed most frequently are wearing of the mask, social distancing of at least 6 feet. If you're sick, stay at home and avoid crowds. I thank you for your continuing positive involvement in our joint fight against this deadly pandemic. There is light at the end of the tunnel, but we haven't got completely through the tunnel yet. And there is concern about the possibility of a spike of some magnitude resulting from the recent spring break from schools, colleges, and universities. We'll just have to see how that works out. Due to the current excellent coverage on this pandemic we're having, I've determined it's no longer of utility to continue these weekly briefings, so we're going to discontinue. This will be our last scheduled weekly briefing, but we will continue to brief when anything of significance comes along that we think might be beneficial to the public. So I thank you again for your cooperation in this and our joint effort. This concludes our briefings for today. I thank you and good day.